Hello, and welcome to Preferred Professionals of America. I'm your host today, Melissa Castellano, and in today's episode, we have the privilege of speaking with Dr. Bonnie McLean, a renowned expert in the field of Oriental and Integrative Medicine. With an impressive career spanning over 5 decades, Dr. McLean has established herself as a top industry professional. Her dedication to patient care has earned her recognition as a preferred physician, and she's been honored as one of the Empowered Women in Medicine in 2023. Join us as we delve into Dr. McLean's vast knowledge and gain valuable insights from her wealth of experience. Without further ado, let's go ahead and meet Dr. McLean. All right. Hi, Dr. McLean. Thank you so much for being here with us today.
Thank you, Melissa. Thank you for having me.
So this is a topic that I'm excited about today. It's near and dear to my heart, being a patient of integrated health for over 10 years now and loving what you do. I want to hear from you. I want to hear, as an expert with an impressive over 5 decades in your field, can you tell us what inspired you to become a doctor and specialize in Oriental medicine?
Probably, well, I always knew I wanted to be a healer all my life. I never questioned that. It was just how I was going to do that. But my father and mother inspired me. Dad was a doctor, he was a surgeon, and my mother was a nurse. So I grew up in a medical household. And, at the time, women only had like teaching, nursing, beautician, or secretary. That's all, in my generation, that's all those are the choices we had. So my way of wanting to be a healer was to become a nurse. And I did. And I did that for 20 years
Wow.
and loved it. But I started seeing the medical system change. And I just felt like this is not going in the direction where I want to be. So I thought I would be a counselor. I went and got a master's in counseling. And
Mhm.
then I fell in love with a crazy Italian acupuncturist, one of the early ones in the country. And he talked me into, looking into that instead. And he had helped, found a school and was teaching in it. And so I went back to school for another 6 or 7 years, 6 years, I think. Yeah. So, and I've been doing it since 1983. I love
Wow.
it. Yeah, I love it. And I'm 79 and, I still see patients. To
Yeah.
me, I'm doing my calling. So why would I retire from that?
That's amazing. And, did I read this correctly about you too? So you had mentioned that you mentioned your father was a doctor, and upon his passing, he had written some books, and you had seen that he had a few pages about acupuncture. Is that something you ever talked about with him, or did that just come about? Like, that's pretty interesting.
It is interesting. I think I did probably talk to him way back when the book
Mhm.
was first published, but I obviously had forgotten. And when after he died, the last time I saw him, I did a treatment on him. He was having problems, which he thought he had allergies, but it turned out to be throat cancer. So I flew to Pensacola and I did an acupuncture treatment on him. And my brother came down and kind of did laying on of hands while I worked with him. So we got to have a in, you know, goodbye period. And then
Okay.
he died probably I guess, about 6 weeks later. But yes, he and mother were my inspiration. And in his book, obviously, he'd been wounded in World War II.
Hmm.
And he used to fly over to the Orient to get acupuncture.
Okay.
So he was having vertigo and
Mhm.
tinnitus, and he was missing an eardrum. So I don't think acupuncture would have done a whole lot for that. But apparently, it was enough for him to keep flying over there.
Right. And amazing too that as a medical doctor back then as well, that he had the faith in acupuncture back then when it wasn't as, mainstream as it then became. So that is pretty incredible. And having them as an inspiration is heartwarming as well. So very nice. So as a physician with a specialty in integrated health, tell us how advances in your field have benefited patients.
Wow. I just know we've kind of gone mainstream now. When I first started in 1983, we weren't well known. I was actually nervous about coming back to Pensacola because it wasn't, I had been in California where more people knew about it. And
Mhm.
I was kind of nervous, that I was going to be burned at the stake or something. when I came back.
Right, but
So
because that's probably what you were made to feel back then, and right, and I wanna say, like I mentioned, like, I've been a patient for probably over 13 years, and even in my small circle of family and friends, not many people around me back then, like, and we're not talking many years ago, had the belief or the faith in what it is today.
Well, it's
So
true, and think about it. I mean, it's not logical to think that you can put these tiny little needles in somebody and make a difference.
right.
But what I love about it is it doesn't fix anything. People always
Mhm,
ask me, does acupuncture fix this or that? I'm going,
mhm,
no, it doesn't. What it does is it brings the body back into its own homeostasis, its own
right.
balance, and the body heals itself. And that's what I love about it because each person is their own healer, really. And it
Yes.
depends on what kind of lifestyle changes they're willing to make and,
Mhm.
how much treatment they're willing to get to feel better. So
And that brings me to my next question because, adding to your already stellar reputation as a doctor, you specialize in pain management and stress related conditions, including addiction. And why is this area so important to address holistically, which you were kind of touching on? It has to do with the mental state that you're in, but go ahead and tell us a little bit more about that.
well, the reason acupuncture, and I work a lot with addictions, the reason acupuncture helps with that is that it stimulates the neurotransmitters in the brain. And
Mhm.
a lot of times that's what addiction is about, people trying to find a way to have that sense of well being because their neurotransmitters are out of balance. So the acupuncture helps bring those back into balance. I use a lot of auricular acupuncture because that works a lot on the emotional. I think there's an embryological connection to the brain
Okay.
from the ear. So I use that a lot when I want to, stimulate the endorphins and give people a sense of well-being. And once they have that, and it also helps with the withdrawal symptoms. So it
Mhm.
really, helps calm everything down. Of course, they have to do their own work as well. We're a partnership, though. I always see us as like they're the leader of the orchestra. They're the orchestra. What do you call it? The conductor.
The
And
conductor, yes.
yeah, so they can point to whatever they need. Like
Mhm.
I might be in the string section. The chiropractor
Mhm.
might be in the drum section. The MD might be in the horn section. So they're the ones that really pick and choose. And I don't think a lot of times people see it that way. I don't think I think a lot of times they just expect to go to an expert who is going to fix them.
Right.
And it may happen temporarily, but not in the long run.
Right, and then that brings me to the type of patients that we have, right? So what would you say are the three most important characteristics of a successful patient before and after treatment? And one just being you have to be ready yourself,
Mhm.
to receive the treatment. And I don't think that, like you mentioned, they really see that at first. So go ahead and tell us what you think about that.
Yes, definitely. And they also a lot of times somebody will refer them, so they don't really know that much about it. But the
Mhm.
people that do, I do get a lot of patients that have had acupuncture in other places, and they know that that's what they want.
Mhm.
But yeah, a lot of times they don't, but then they'll have a family member that got some help and or a friend and they'll come that way. But a lot of times they'll come to me as a last resort than as an early resort. And to me, I'd rather see them see me earlier
Mhm.
because it can work more on the prevention level than our Western medicine doesn't do much for prevention. We're great when it comes to surgeries,
Right.
medications,
Mhm.
procedures, life changing, things, life threatening conditions.
Correct.
When it comes to overall health, I feel like, that's why I feel like I'm an integrated practitioner because as a nurse, I believe in Western medicine. I
Mhm.
know the beauties of what it is and what it can do. But to me, our culture doesn't embrace, the prevention part as well as it should.
Right, and I have to agree with you there. Being a mom of a NICU baby, so who was there, that medicine saved her life. But a lot of the times now, when you're looking to treat um, other symptoms and other things, you're given a Band-Aid if it's not something as serious as something like that. So, integrated health definitely delves more into um, our needs. They don't get dismissed. So doing what you do is so helpful to others, and it's no question that patients have rated you 5 stars, doctor, for your expertise, your compassion, nominating you as the patient preferred physician, and you've even been featured, I saw, as the Empowered Women in Medicine in 2023. So you've shared your expertise on podcasts and health publications. Why is educating your patients and public so important to you?
Well, because it's empowering to them and it gets them out of that mindset of the quick fix. We live in a culture of quick fixes. That's what we
Yes.
look for, that's what we expect.
Yeah.
And healing isn't that way. It's just
Mhm.
not a quick fix. And they have to participate as well. So
Mhm.
I'm like I said, I'm not gonna, make them think that I'm fixing anything. And
Right.
those, once they get on board and see that they're making the changes, they feel self-empowered. And a lot of times that'll encourage them to continue.
And can you, I always throw out a question here. Is there any memorable patient case or anything that in all of your years sticks out that, that person came a full 360 on their own? I'm sure you have many, but is there any that stick out that is quite memorable to you?
I do have a lot like that.
I'm sure it's so hard. But how about as
Yeah,
far as, maybe even situational, like
yes.
what type of patients?
But like I see a lot of VA patients, and there's
Mhm.
one that comes to mind because they're the most skeptical of all. And a
Right.
lot of times they come in grumbling like, "Why is VA sending me here? I don't know what this is going to do." And so my very first VA patient was that way, and I guess they had tried everything with him, and he came reluctantly, and I could hear him grumbling out in the waiting room. So when I brought him back, I worked on him, and by the time he left, he said, "Can I take you home with me?" And
Oh,
he has
yes.
just been, and he has helped spread the word among the VA patients. And
Mhm.
that's a lot of times how they end up coming in is they'll
Yeah.
be, all in the doctor's office together and they'll start talking about it and, encourage each other to come in. So I love it, when somebody doesn't believe in it and then
Yeah.
I see the miraculous change in them.
And that's that change of mind, like changing that mindset. And it's so hard to do, especially you're talking about VA patients here, and those mindsets are really hard to change. So that's pretty amazing. So, what can you tell us, doctor, about the future of holistic and integrative care?
I really think we're going in the right direction with it. I have, like I said, I mean, since I've been doing it since 1983, I have seen some major, major changes. And
Mhm.
as I said, when I came back to Pensacola from California, and I just thought, oh man, I don't know about this. What have I done and everything? And to see the changes here, we have a lot more acupuncturists here than,
Mhm.
I think than there were maybe like it might have been 3 of us, in the beginning, and we
Mhm.
have a lot more now. There are more people going into the field, and um, again, like when I first went into it, I really wasn't sure we were going to survive as a profession
Mhm.
because Western medicine did not let us in. They did
Right.
not want us as part of the mainstream.
Mhm.
So, I wasn't sure, but because it does work, word of mouth, and people read things now, and so they're beginning to be more open to at least trying it. And I'll usually tell them, just come in 3 or 4 times.
Yep.
If we're not getting any response at all by then, I'm not going to pull your arm or twist your arm or try to get you back in here. And
Mhm.
usually, and I feel that way too. Either the acupuncture isn't the right thing for them, because to me, there's something for everybody, and there's
Right.
some person for everybody. And I
Mhm.
may not even be the right practitioner for them. sometimes personalities need to gel to be able to be, to respond.
Yes.
So over the years, I've just learned, that each to their own, and I
Mhm.
support whatever makes somebody feel better.
Well, you just answered my last question there. Just, leaving the listeners today with how to find the right practitioner where they are. And, exactly what you just said. You have to make sure you connect with them and give it that 3 to 4 times, to keep going and making sure that it is the right fit for you too. Did you have anything you wanted to add to that?
I think it's helpful to get word of mouth to
Hmm.
find out who else has had acupuncture and with whom,
Hmm.
and also to look them up online and look up to see the recommendations there, and to study a little bit on acupuncture themselves. They
Hmm.
can read my book.
Yes. And the title, go ahead and tell us the title of your book.
Integrative medicine. Here it is. Return of the
Perfect.
soul to healthcare.
And I did see too that you had some interesting chapters in other publications. I love some of the names in some of those other publications that you had. So we could check that out more online as well. And we thank you so much for being here with us today. And, we thank you for what you do and continue to do after 5 decades. So we wish you all the luck in the future as well. Thank you so much.
Thank you.